Hey guys, so yeah, it's still kind of using my phone, still getting used to the whole um, trailer living thing. I'm pretty sure I said that on Monday's video, um, but yeah, it's still kind of new to me. I actually bought a dehumidifier today because I woke up feeling pretty shitty just because I guess how damp it was in here and cold. So it's either really cold or really hot. There's no in between, and it was always really, really damp. Um, so yeah, I'm still trying to get set up and everything. So yeah, I guess I'll go through the whole Wednesday's treatment, which today is July 17th, I believe. Yeah, because Monday was the 15th. So yeah, I'm gonna put all these together at the end of the week when I get back home to Jacksonville, and then edit it and post it. But yeah, today's treatment, of course, was the same as last week's. The only difference was instead of just ozone, they did ozone with UVBI, or UVBI, yeah. But it's less ozone. So yeah, I guess I'll say how the treatment went today, and then I'll make some comments about everything, and then what I'm doing afterwards. So today's treatment, of course, like IVs and stuff, I mean, they went okay. I didn't really notice as big of a change as I did last time. I think it's just like the amount of ozone and whatnot they do in the normal autohemotherapy versus this one. They usually say people feel a bigger effect and whatnot off the UVBI. I don't think I didn't really feel anything, honestly. That's just me. I think I'm dealing more with the autoimmune things. So that's just my thoughts on what's going on with me. Sjogren's still seems very likely, since that's pretty much everything I'm dealing with. Super dry eyes all the time, super dry sinuses that are always inflamed, dry mouth, like, except they eat blueberries, but my tongue's usually white from like being so dry, and then of course intestinal issues and all that stuff. So Sjogren's just always seems very likely. Still waiting to get the biopsy for that, but that's still what I'm feeling like for that. But yeah, I mean, I did those IVs mostly just because like IV nutrition isn't really bad. IV glutathione has benefits. There's apparently some benefits of ozone, but the rest of the stuff just it still seems really hokey to me, even though ozone is kind of ish. But so far Western medicine has kind of failed me as to why I'm here. But I mean, like the PEMF and the MAT, and of course anything to deal with like homeopathy and meridians and stuff still kind of throws me off. I mean, I can understand like if people are looking for a placebo effect, but I mean, I definitely have understood so far, being sick for 10 years, what's probably placebo and what's not, just because I've had things that are like, wow, this definitely works in a certain way, like Towardum. Definitely had some anti-inflammatory, autoimmune reducing effects on me. So one of the things I have has artemether in it, and it's been helping a little bit. It's of course not as strong as Towardum, but it is in a spray, which is kind of nice, so it doesn't really like mess up my stomach or anything. So I mean, I definitely still like things that are like at least semi-scientifically proven in some way, shape, or form to have some effect. So Friday I'm gonna drop everything but the IVs and that, I guess the supplements, and I still haven't got to do the ozone sauna, but I do want to try it just to see what happens with it. So I did schedule for that. I don't really know much about it, but it seems like something that may or may not do something. But at this point I'm just trying to look for inflammation reduction, mostly. But another thing that also kind of threw me off is everyone seemed to only be working there for like a few months. So I'm not going to make any comments on that. It just kind of made me wonder, okay, why is everybody new? whether it's they started questioning things themselves, or it was just they're in like, why is that just the thing in the nursing world in general? Like maybe somebody can comment, like, is it a common thing for people in like practices and hospitals and stuff to only be working at a certain place for like 2 or 3 months at a time? Because everyone I talked to there is like, oh, this is my second month, oh, this is my first month, oh, this is my third month. And like nobody I talked to, with the exception of maybe like 1 or 2 people, like the main doctor of course, and 1 other nurse, had been working there longer than a few months. So I'm just kind of wondering like what the deal with that is. Like maybe they just didn't agree with things, or they started questioning things. It just made me worry a little bit. Of course, that's just my skepticism of everything. So that'll be me, unfortunately. But I mean, other than that, I'd still try to remain hopeful. I mean, I'm in a travel trailer, so if this fails, then it'll be on to the next thing. I mean, I still feel like there's a very Western medicine reason for why everything's going on with me, and probably a very Western medicine solution. It's just it hasn't been figured out yet. So I still definitely believe in Western medicine a lot. And I mean, I do believe in alternative therapies and whatnot in certain ways. Like I do know like some supplements do help people, and I do believe like being healthy and exercising and overall maintaining a overall healthy diet's probably the best thing you can do. But as far as some of the alternative therapies, I think they're mostly just placebo based and making people feel certain ways. And there was actually one person I talked to that kind of worried me, because I definitely believe she was sick. Like she had similar symptoms as me, like except she could only eat sweet potatoes and cucumbers apparently, but she had issues with sugar, so the sweet potato thing didn't really make sense to me too much, just because it of course breaks down into a lot of sugar and carbs. But yeah, I mean, it was just what a doctor had told her over the phone, and like apparently did some over the phone treatment to her, and then she reacted to electricity, and then all of a sudden she can't eat foods. It was really weird, and she just wasn't getting any better. And I was just wondering, I was like, okay, well, I believe you're sick, but you obviously believe everything any of these people tell you. And even with normal doctors, like, they don't know everything. Like, it's probably good to question, like, people. Like, I mean, maybe I'm a little too skeptical, but I don't believe everything anyone tells me at this point. And I never even did before. Like, I was definitely willing to try something at least once, see if it helped. I mean, some of those things probably got me in a little bit more trouble, like the itis. Like, I'm still suffering from and regretting. So I don't really know what I'm gonna have to do to recover from that one. But yeah, I mean, everything else has just kind of been kind of things I've been a little bit more skeptical of. And sorry, I'm a little fuzzy today. Still kind of trying to get back on track, but yeah, I mean, otherwise, I mean, of course, Monday, Wednesday, and Friday, it's really hard for me to watch the market considering I'm at the doctor 9 to 3. So I don't even bother like doing any scans or anything like that. I mean, I'll check cryptocurrency prices on my phone every once in a while because I have CoinMarketCap, but that's about it. Other than that, like, I'm hoping I finally got my school situated. They said my course was in transition, and everything posted on my assessments wasn't necessarily what they wanted me to do, and it might be in the announcements or something. I was really confused. So hopefully I can get that back on track tomorrow. Other than that, I got to figure out a way to redirect the air on the AC, because that was kind of getting to me a little bit, and I also need to figure out how to put a bigger water tank on this trailer, because 5 gallons is not a lot. So I mean, if I'm gonna plan to use this thing longer than a few weeks, yeah, I need to plan how to do more water. But otherwise, I've just been kind of hanging out with my Chihuahua. He's just kind of passed out. Doing pretty good. But yeah, I mean, if you guys have any questions, just let me know in the comments. I mean, I'm not gonna like tout anything as like, hey, this is a miracle, hey, like do this, hey, do that. I'm very skeptical of a lot of things, especially things that are like MLM based treatments, and people are making it seem like a miracle. I'm not gonna do that. Like, if something helps me, I'll tell you. If something for some reason like cures me and my eyes start watering nonstop and I can eat more than just freaking the 3 foods I'm eating, I'll let you guys know. I don't see that happening with this place, but if I even get 20% better, I'll let you guys know. I'll be like, hey, like, this probably isn't going to cure you, it's not a miracle, but it might be worth checking out for a 20% reduction in your symptoms. So I want to be very realistic on that. I don't think miracles necessarily exist in medicine as far as like miracle treatments, but I do believe in things that of course will get rid of normal bacterial infections, but I do believe for people dealing with more things, there are things that will provide a decent enough reduction in symptoms to provide the relief to where it's worth checking out and worth your time. And I believe for almost anybody there's at least 5 things you can do to improve your life. So I mean, I've had friends and family who I see, like, I mean, what they have going on isn't as bad as what I have going on. I mean, it sounds very like condescending to say, but as far as like what they can do and what they can eat and like overall majority of their symptoms, yet they're in worse shape than I am. And I just believe that's because they haven't bothered to explore the things that could help them, or try the things, or find the 5 things. I mean, even sometimes it's giving up things, it's not necessarily adding in things that will help a reduction in your symptoms. So that's pretty much all I'm saying, is that I believe for everybody there's at least like around 5 things that you can do to get a significant decrease in symptoms. But yeah, if you guys have any questions for me, I can always tell you what I'm doing currently if you guys want to know. But awesome, yeah, I guess I'll post another video on here Friday and give you a final update to my first week before I head back home. Alright, bye.